right, so February is here and Valentine's Day is coming up. So today we are going to talk about how to find your provider match and how to break up with that provider if they end up not being the best match for you. There's just so much information out there. Multiple providers with multiple different titles, job responsibilities that can be very overwhelming for people because there's a lot to kind of filter through. And also a lot of people don't necessarily always know what those titles are, what the role and responsibilities are for those providers. So sometimes it can be really difficult for people to narrow down. It can be a little overwhelming. Finding the right provider is really important. So a lot of times people, like we mentioned before, don't always know exactly who provides what services, for example. So primary care physician, right? Really great at evaluating, diagnosing medical conditions and doing treatments for those type of things, but they are not kind of our first line defense for psychotropic medication. A psychiatrist would be, because that is their specialty, is medication management. A lot of times people think that psychiatry is also therapy, not the same thing. Team of people, they all have their role. So it is really important to find the correct provider to ensure that they are providing you with the best care within their specialty to help support your need. When you're looking for services, where do you even start? Kind of cop-out response, but it really depends on what you're looking for and what your need is. So if you are concerned about anxiety or depression, any of those things, step one would just be to start looking for a therapist. That therapist can also help support psychiatric or services, or to see a psychiatrist as well. Some facilities have both. To narrow down the clinician that you want to see, start putting out some contacts for a consultation to find the therapist that you want to see and get in the door. If you are more concerned about potential neurodevelopmental diagnoses or decline in cognitive functioning or any of those things, or academic concerns, educational concerns, those type of things, IEP 504 plans for schools, accommodations, etc., then that is when first line of defense would be go to a neuropsychologist, be evaluated, ensure that you are getting the correct diagnosis, and then that neuropsychologist will provide recommendations of the next steps then for interventions, for strategies for treatment, whether that's then therapy or psychiatry or whatnot. But that is always a great place to start. When it comes to providers, at least in the psychology field, whether it's psychiatry, whether it's a therapist, psychologist, neuropsychologist, whatever the case may be, it is important to ensure that you fit with that clinician in general. I always talk about how therapists are like shoes. Kind of need to try them on and walk around for a minute to see if they fit and feel good, right? So ensure that they're comfortable. And a lot of times I hear people say they'll go to a clinician and they'll see them for maybe 1 or 2 sessions and then they'll leave. And they say, I just don't think therapy is for me. It's not true. Therapy can be for everyone. But it's just that clinician wasn't necessarily for you. Not all clinicians fit with every client. It's just not how that works. We all have different personalities. We all have things that we can offer. So that doesn't mean that therapy is not for you. It's just that clinician wasn't right for you. And so just keep looking for another clinician that is a better fit. So of course, it's very important to ensure that they have the training in the concerns that you have, that you're going to see them. So ensure that they have the education, they have the training, they have the experience and expertise in that, as well as that they're licensed, right? That is also important, that they're licensed in the state that you are seeing them in. It is really important for therapists to help facilitate with clients to developing goals, help people develop strategies and interventions to use when they're not just in the therapy space, but when they leave, to implement some of those things in their day-to-day life to help manage some of those symptoms or those things that they're working on, to help them get to steps towards progressing to their goals. How do we break up with our clinician or our therapist if they don't end up feeling right for you and a good fit? And it doesn't matter if it's 1 or 2 sessions in, or if you've been seeing this person for a year. It's tough. It's uncomfortable. No one likes that, right? And a lot of times clients can feel stuck. The best professional advice I can give is it is your right to have effective services for you, to have helpful services for you, to get out of it what you hoped to. And if it's no longer that, then it's your right to change that situation for yourself. And you shouldn't feel bad about it. Doesn't mean it makes it easier with me saying that, but most therapists should be checking in with you regularly about how things are going, progression towards goals, just checking in general. If they don't, though, then I encourage you to just breach that conversation. Just say to them something, for example, hey, I just want to take a second at the start of this session to just talk about where I am right now and the effectiveness for therapy for me in this moment. I've gained some insights in working together, and it has been very insightful for me and these type of things, but I don't think that this is a therapeutic relationship that is offering me everything that I need right now, or even, I want to kind of reevaluate therapy for myself. Again, it is about you and fulfilling your need. So I encourage you to just breach that conversation with your clinician and just let them know kind of how you're feeling. And it's okay to feel that way. And doesn't mean that therapy's not right for you. It just might mean that you've reached the extent to which that particular provider can really fulfill your need. And it just might be a point in which you just might need someone else with different expertise in different areas, and that's okay. And again, we are here as a support. If anyone needs, kind of consultation on how to go about doing that, send us a message on our website or any of the socials or any of those things as well, and we can kind of help guide in some of these things that we've talked about today, whether it's finding your perfect provider match, or whether it's ending or breaking up with that provider. Happy February, happy Valentine's Day if you celebrate, and please reach out and follow us on all the socials at Snapdragon Wellness, and we look forward to connecting